Hello and welcome to our quick tutorial on how to request an appointment, get on a waiting list, join a distribution list, or subscribe to other types of notifications. This tutorial is intended for patients of healthcare providers who use the OfficeFLO platform. OfficeFLO Sign-Up Portal is a simple and easy to use, secure and HIPAA-compliant platform developed using a proprietary patented technology from the ground up for patients and healthcare providers. Patients can use an OfficeFLO sign-up portal to request an appointment, get on a waiting list, join a distribution list, or subscribe to receive other types of notification from their healthcare provider. For example, to receive notification about office delays and closings, or to receive general announcements about news and changes in the healthcare organization. You can find the OfficeFLO sign-up portal page by visiting your healthcare provider's website, whatever the domain is, .com/signup. For example, yourcaringdoctors.com/signup. You can do it anytime, and your healthcare provider will be able to respond accordingly using the verified email address or your mobile phone number that you provide, with the peace of mind that you will not miss an important notification, for example, due to incorrectly recorded or out-of-date contact information, misplaced notes, or getting left out by accident. When you open a sign-up page, you can enter your name and your date of birth. If it's a multi-provider practice, you can sign up to receive notifications for a specific provider, or you can choose any provider. If you're not sure which provider to choose, you can select undecided, and the staff will determine the best course of action for you based on the comments, or will contact you to get additional information to assign you to one or more providers that will apply in your situation. Next, you will need to select the type of notification that you would like to receive. For example, to subscribe to a waiting list for new patients, to subscribe to a waiting list for existing patients, to set up an appointment, or subscribe to receive notification about office closings or delays, or to receive general announcements about your healthcare provider's practice. Then you can enter your email address or mobile phone number, or both. For example, when subscribing for urgent and more interactive type of notifications, such as when getting on a waiting list or when requesting an appointment, you may prefer to receive text messages with or without email. And when subscribing for non-urgent or non-interactive notifications, such as general announcements, you may want to use only your email address. You can also use different email addresses for different types of notifications if needed. For mobile phone numbers, you will have to use a number only from wireless providers, such as Verizon, AT&T Wireless, T-Mobile, and such. Voice over IP numbers or landline numbers are not supported. If you attempt to enter a voice over IP or landline number, you will get an error message. Next, you can enter comments that can help staff to determine the best course of action. For example, if you subscribe into a waiting list, you can specify the reason for your visit, or a health issue you're concerned about, or type of appointment you're interested in. Next, you can press a button to send email and mobile verification codes, whichever apply, and you will receive an email with 6-digit verification code and a text message for a 4-digit verification code. You will need to enter verification codes for your mobile phone and email as needed. Then you will need to complete the reCAPTCHA test to prove that you're not a robot, and then press subscribe button. You can now choose to select another type of notification or another provider and repeat the same steps as many times as needed. For example, first you can request an appointment, then you can subscribe to receive notification about office closings and delays, and later subscribe to receive general announcements. You can choose for which notifications you want to be contacted by email, and which notifications you want to be contacted by text on your mobile phone, and which notifications you want to receive both by text and by email. For example, if you're looking for an appointment, you can subscribe to receive notification both by text and email, and if you're looking to subscribe to receive general announcements, you can subscribe to receive notification by email only. And this is all. Thank you for watching. If you have any questions or comments, please reach out to your healthcare provider.